From ancient times, medicinal plants have had an important role in maintaining the health and happiness of mankind. The research results of archaeology have found traces of the use of medicinal plants in the Middle East from around 60,000 BC. However, until the emergence of the Egyptians, the Middle East, and Chinese civilizations in the BC era, the mastery of new herbals has become more sophisticated. The first documents were written about medicinal plants. Prescriptions tested through times. The brief introduction to traditional Vietnamese medicine. Part 1. Vietnamese medicinal flora and fauna. The Vietnamese medicine is rich and diverse. The country has a unique location offering bountiful plants and wildlife. The land stretches 3,400 kilometres along the coast, which mostly consists of inaccessible mountains and buzzing jungles. The warm and sunny climate, with plenty of tropical rain, creates an ideal environment for the flora in general and medicinal plants in particular. Hai Tung Lan Om, a well-known Vietnamese physician of the 18th century, wrote, "Medicines are everywhere, in the gardens, on the fields, up the hills, down the rivers. Thousands of medicinal plants and animals. Numerous tonics and effective medicines are grown around us." Since ancient times, Vietnamese people not only have been gathering wild medicinal plants, but also have been cultivating them. The most well-known farms of medicinal plants are the Medicinal Mountain in Quang Ninh Province, botanical gardens of medicinal plants in Ninh Binh, and Dai Yên village near Hanoi. Moreover, Vietnamese people like to grow medicinal gardens around their houses. This tradition probably started around the 14th century when Tuoi Tre, a well-known physician and Buddhist monk, had promoted growing medicinal plants around the Buddhist temples and in the countryside. Traditional Vietnamese medicine evolved from folk medicine when people passed through the generations. The skills of gathering, cultivating, processing, and prescribing medicinal plants. Part 2. The theories of yin-yang and 5 phases. At first, Oriental medicine theories seem complicated and difficult to understand. But once they are examined deeply, they become very simple and natural, like the environment surrounding us. Oriental medicine views human beings and their environment in the context. A human being is seen as the universe in miniature. Oriental medicine reasoning is based on an ancient Oriental philosophical view of the universe. According to this, the universe is a gigantic sphere consisting of 2 opposing parts or energies, yin and yang. When these yin and yang interact, it affects circulating energies, namely metal, wood, water, fire, and earth. Another factor is the 3 forces, namely the sun, the earth, and the human being. Each of these 3 forces is determined by yin-yang and the 5 phases. The lack of balance inside each of these 3 forces, or between these 3 forces, results in human sickness. Thus, treatment of the sickness is simply the restoration of the balanced relationship between yin-yang and the 5 energies inside the human being, and between the human being, the sun, and the earth. According to the yin-yang theory, anything that is mobile, dynamic, external, upward, warm, or hot is yang. In contrast, anything that is static, inhibited, internal, downward, cool or cold is yin. In the nature, the sun is yang, the earth is yin. Day is yang, night is yin. Fire is yang, water is yin. In the human being, yang refers to the lateral side. Back, upper body. 6 yang organs and energies. Yin refers to the middle body part. Chest and abdomen. Internal organs. 5 yin organs and blood. Yin and yang energies are opposite, but united to maintain a balance, ensuring their survival, because yin or yang cannot survive on its own. Yin and yang is symbolized by 2 equal parts. The white part with a black dot represents yang, and the black part with the white dot represents yin. These opposite coloured dots show that yang contains yin and vice versa. Applying yin-yang theory in Oriental pharmacology, the Oriental medicine is classified by 4 energies, 5 tastes, and lifting and sinking, and floating and depression. The 4 energies consist of cold and cool are yin, warm and hot are yang. The 5 tastes include spicy and sweet, which are diffusing, are yang, sour and bitter, which cause diarrhea, are yin. Salty is yin, while insipid, which is diuretic, is yang. Lifting and floating are yang. Sinking and depression are yin. The use of Oriental medicines is always based on their properties, classified as above. Besides the application of yin-yang theory, Oriental medicine also applies the 5 phases theory to refer to the internal relationship inside the human body. The 5 energies consist of wood, fire, earth, metal, and water. The 5 energies correlate through mutual generation and mutual inhibition. The generation and inhibition are dedicated to maintain the balance. Generation without inhibition results in hyperfunction. Inhibition without generation results in hypofunction. Oriental medicine applies the theory of the 5 energies to classify and prepare medicines. Based on their scent and taste, medicines are classified to be effective on the corresponding target organs. For example, a medicine having a sweet taste, a yellowish colour, will be effective on the spleen, stomach, because sweet, yellow, spleen, and stomach correlate the earth energy. A medicine with a spicy taste, a whitish colour, will be effective on the lungs because spicy, whitish, and lungs correlate to the metal energy. Similarly, the preparation of medicines is also based on the theory of 5 energies. For example, to produce a medicine effective on the kidneys, black beans are used because both black beans and kidneys relate to the water energy. Or the medicine will be marinated because salt and kidneys correlate the water energy. To prepare a medicine effective on the liver and gallbladder, it must be put in vinegar because vinegar is sour, and sour, liver, and gallbladder correlate the wood energy. To prepare a medicine effective on the spleen and stomach, it must be put in honey, because honey is sweet, and sweet, spleen, and stomach correlate the earth energy. According to Oriental medicine, the properties of the medicines also depend on their effect on the meridians of energies. For example, the meridians of liver and gallbladder relate to the wood energy. Based on the table of 5 energies, green colour and sour taste relate to the wood energy. Thus, any medicine having green colour and sour taste will be absorbed into these 2 meridians. Similarly, medicines having yellow colour and sweet taste relating to the earth energy will be absorbed into the meridians of the spleen and stomach. Thus, according to Oriental medicine theories, based on the colour and the taste of the medicines, we can predict their action on the meridians and organs of the human body. Part 3. Vietnamese Herbal Manuscript. Before Jesus Christ, Vietnamese already knew about hundreds of medicines and their use. However, The practice was transferred only orally from generation to generation, without any written records. The situation had changed in the 15th century, when the first Vietnamese work on the material of medicine was written by Pham Phu Tien and called The Manuscript of Essential Flora, describing 392 Vietnamese medicinal plants. Another landmark in history of Vietnamese pharmacology was made in the 14th century by the well-known physician and Buddhist monk Nguyen Ba Dinh, also known under the pen name Tuoi Tre. In his book, The Wonders of South Medicines, the author described in detail 499 medicines and 3,932 prescriptions used for the 10 therapeutic domains. He also classified the medicines into 22 types: wild grass, filament grass, water grass, cereals, and birds, etc., to help the farmers in growing and harvesting these medicinal products. Tuoi Tre wrote many of his medicinal books in Nom, the ancient Vietnamese characters, and used Phu, the popular poetic style close to the Vietnamese habit, to memorize popular proverbs and songs. Both 17th and 18th centuries constituted the golden age of Vietnamese pharmacology. Lots of authors and their works left significant impacts. The most influential work, the medical knowledge accumulated by Hai Thung, Ray Kuschert. The book has 28 volumes and is considered to be the encyclopedia of Vietnamese traditional medicine. Ray Kuschert systematically classified and described in detail about 800 Oriental medicines. Each medicine has a record of pharmaceutical properties, main action, indications and contradictions, and preparation techniques. In another book, The Valuable Treasure of 100 Families, Ray Kuschert also shared his family experiences as well as effective prescriptions to treat complicated, severe, and rare diseases. Ray Kuschert was also the first Vietnamese scientist who systematically recorded and followed up the unsuccessful cases and the successful cases to evaluate the clinical effect of the Oriental prescriptions. Part 4. Prescription Preparation. The objective of Oriental prescription preparation aims to use the therapeutic efficiency of each medicine, combining to attempt to reinforce such efficiency by reducing or eliminating the toxic effect. Oriental pharmacology considers energy and taste as very important properties of the medicines. It is why preparation techniques such as roasting and absorption are commonly used to change the energy and taste, and thus the properties of pharmaceutical products. In total, there are more than 30 different preparation techniques. Many times, 3 or 4 techniques are used together for the same pharmaceutical product. The chronological order of the techniques is very important and must be respected. Theoretically, from the various parts of the one medicinal plant, such as the fruits, seeds, flowers, leaves, twigs and branches, barks, trunks, and roots, etc., Vietnamese physicians can prepare more than 100 different pharmaceutical products. Oriental pharmaceutical preparation techniques can be classified into 4 groups: by hand, by water, by fire, by combining water and fire. Certain medicines must be prepared in a very sophisticated way. Tuoi Tre described a preparation technique used for the monk shot as to preserve in salt at least in 6 months, then to cook it with black bean or licorice root, then dry it under the sun. After that, cook and dry under the sun many times before using it. Another, Rehmannia root, must be prepared according to the procedure of Cu Jung Cu Sai, that is, to cook it during 2 days and 2 nights, and then to dry it under the sun. The cooking and the drying are performed 9 times. Ancient books also recommended to prepare in early hours before the rooster wakes up, or to prepare in a solitary area where nobody can witness. The medicine can also be done at night or on special days, according to the lunar calendar. These recommendations seem odd. However, they may result from the tendency to unite the seasonal climate and universal factors. Moreover, many respect these principles, believing that such principles result in reinforcing the efficiency of the medicines. In the past, people reasoned that if a court has a king, the officials, then a prescription must also have a main medicine and an additive one, a dominant medicine and a supportive one. Physicians commonly prescribe a combination of 4 medicines classified as king, official, assistant, and messenger. King is the main medicine to treat the pathology and solve the main symptom. Official is the supportive medicine to reinforce the effectiveness of the main medicine. Assistant medicine has 2 objectives: to inhibit the main medicine whenever it's highly toxic or somewhat devious, and to support the main medicine to solve some additive pathological symptoms. Messenger also has 2 functions: to lead the medicines into the meridian and organs, and to reach a balance. For example, decoction of ephedra is a combined prescription of medicines aimed to extract the harmful energy of cold wind out of the body in the treatment of asthma caused by the action of cold, heat, resulting in no sweating. Ephedra is king, the main medicine to enhance perspiration and skin detoxification. Cinnamon is official, the supportive medicine to reinforce ephedra in its detoxification effect. Almond is assistant to help ephedra in relieving the asthma attack. Licorice root is a messenger, the regulative medicine to regulate the actions of other medicines in the combined prescription. Ancient people viewed the use of medicines as similar to the use of military tactics. However, this is only in theory. In practice, there is no unique model to be applied for all situations. Treating one illness might have only one medicine. Treating others have 70 or 80 medicines. Hoang Don Hoa, the famous Vietnamese physician in the 16th century, only used 3 medicines: strychnine, prickly ash, and rilga, combined into the prescription named Tam Hoang Hoan. That is the prescription made of 3 yellow medicines, saving many soldiers serving under Le dynasty from death due to the epidemics of cholera and malaria in 1574. Part 5. Royal Medicines. During the Middle Ages, the emperor is considered to be the son of God. Thus, all the best means to protect the health and longevity of the emperor, king, and aristocrats were in the royal palace. After regaining independence in the 11th century, the dynasty founded the Royal Academy of Medicine to specifically take care of the royal family. So far, many valuable prescriptions designed by the royal physicians and famous physicians are still preserved and transferred. Historical documents also reported the kings supported the medicine and pharmacology. In the spring of 1715, Lord Chin read the handwritten book by Tuoi Tre himself and ordered the officials in the Royal Medical Institute to edit the book and then print it to distribute it all over the country. King Minh Mang is well known in the history of Vietnam for his uncommon health. He had up to 146 children. The king's extraordinary procreative ability made a popular saying, meaning 6 intercourses at night, giving birth to 5 children. So far, Many royal prescriptions designed by the physicians working in the Royal Academy of Medicine to reinforce King Min Meng's procreative ability. These famous prescriptions, named Ming Mang formula, having the action of renal tonicity and strengthening of yang energy, are still kept in the archives of the royal family and its royal physicians. These prescriptions combine many ingredients, usually between 12 and 25, but some medicines have as much as 73 ingredients. Part 6. The identity of traditional Vietnamese medicine. Similar to Oriental medicine, Vietnamese medicine treats pathologies holistically, considering the body as a whole entity, not only as separate organs. The holistic approach takes into account the climate, location, and even patients' habits and lifestyle. Using the holistic approach, the Oriental medicine focuses on two main points. Firstly, it focuses on the symptoms and signs of the organs in question without neglecting those other organs. The Oriental medicine concentrates not only on treating but also on preventing the illness. Secondly, the Oriental medicine supports each person's natural resistance to a disease and then individuals' unique ability to recover. Vietnamese traditional medicine also respects the principles of the diagnostics and therapy practiced in Oriental medicine. It often means a treatment based on the analysis of the disease. This procedure has been used in all medicines all over the world, with the only difference that Oriental medicine focuses on cautioning and fluency in performing the therapeutic procedures. Though based on the medical principles common to Oriental medicine conception, the traditional Vietnamese medicine distinguish themselves by a practical and creative split, not to be limited by academic theories, and by its effective simplicity, also based on the classification theorized by Oriental medicine. Vietnamese medicine adds the description of neglected or reproductive organs of the human body. In his book, Discussion on Medicine, Tuoi Tre added the description of productive organs such as the penis, the perineum, and the breasts, named 3 fireplaces correlating to the fire energy. In this way, he contributed to Oriental medicine in general and to the traditional Vietnamese medicine in particular. Tuoi Tre is also the first to advance a therapy based on the Vietnamese clinical context. He used spicy and sour medicines to treat pathologies due to the heat and humidity, such as prickly ash and polygony root, to treat rheumatism instead of atractalodes and amur cork tree, that Chinese medicine considered as the wonderful medicines to treat rheumatism. Tuoi Tre's point of view was to learn the ancient books, but not to be limited by them, and use the local medicinal flora, which is more available and suitable for Vietnamese people to heal quickly. With this independent spirit, Tuoi Tre's book included many conceptions different from those advanced by other Oriental medical literature. Ray Kuschert selected from the thousands of prescriptions and classified 150 most common medicines in his book, The Essential of Pharmaceutical Ingredients. He teaches that many little studied prescriptions cannot be equal to a few but essential and researched. Many people like this small book, which you can carry in your pocket and use it everywhere. He evaluated it as a true gold bar carried in one sleeve. Although he studied and applied many classical theoretical books on Oriental medicine, he innovated. He wanted to learn from the ancient, but not to limit oneself in this ancient framework. He encouraged that one has to create new concepts suitable to the situation and the natural conditions to expand knowledge and understand better. Another feature of traditional Vietnamese medicine is the fusion, the tradition and innovation. While modernising, the traditional medicine has not forgotten to keep the ancient literature relating to the traditional prescriptions and medicines and their preparation techniques. Nowadays, Vietnam's healthcare has two branches, the traditional Vietnamese medicine and Western medicine. Both branches form the healthcare system, but they still lack a mutual understanding. The Western medicine argues that Oriental medicine still needs to be more scientific in its diagnosis and therapies, and to explain more clearly the diseases. In contrast, Oriental medicine thinks that the Western medicine has a narrow view on the medicine, ignoring the patient's natural environment and treating symptoms instead of the causes of a disease. Oriental medicine was much criticised. However, Oriental medicine has been constantly evolving, but sticks to the main principle of living in harmony with nature. The fact that it has been healing the patients for thousands of years means that Oriental medicine is proven and effective for the healthcare.